37 Balmain Hospital Casualty Service.
I call the member for Balmain. We'll get it right eventually.
Thank you very much, Madam Acting Speaker. Today Madam Speaker, I move that this House notes that the former government closed down the 24-hour casualty service at Balmain Hospital. 2, notes that this decision has denied the people of Balmain an important opportunity, an important community service, and has placed significant additional pressure on the casualty service at RPA Hospital. And finally, calls on the government to restore the 24-hour service at Balmain Hospital. It was in 2004, Madam Acting Speaker, that the 24-hour casualty service at Balmain Hospital was removed by the former state government. And today I call on the government to examine opportunities to overturn this decision to look at restoring the service to Balmain Hospital. It's an important issue not only for the people of my own electorate who have been directly impacted, but also for the effectiveness of the New South Wales health system more broadly. This issue has been steadfastly ignored by the former government, and I'm hopeful of a positive outcome from this government when assessing this matter. This issue is an absolutely vital one for my community. I believe, and I know that those across from me believe, that the community-based medical services should be a priority for government. Those residents who I hear speak on these issues in the local community and raise these points constantly acknowledge the importance of Balmain Hospital. It was in 2009 that the government decided to close this service, and in closing this vital service, they not only broke a promise they'd made to the people of Balmain over 10 years ago when they downgraded the service, the emergency service that was, to a 24-hour casualty service, they also did it against the wishes of the council and the local community. At the time of the closure, I attended as Mayor of Leichhardt Council a community meeting held at Balmain Town Hall, and I heard the local residents voice their concerns about what this closure would mean for them. And importantly, Madam Acting Speaker, it's another example of the former government's position on this issue when there was not consultation with the council, there was not consultation with the community. We were summoned to a meeting at Balmain Hospital where we discussed the issue and we were told that the cuts would be taking place. So even if the government was intent on closing the 24-hour casualty service, at least consult with the council, at least speak to the community. And we are the greatest fans of Balmain Hospital. We're great supporters of Balmain Hospital, and we would have done everything in our power to assist the hospital and assist the government in making sure that service would continue. But unfortunately, Madam Acting Speaker, that was not the case. Residents spoke passionately at this meeting that I mentioned about the need for the service to continue. They told their own stories of how they and their loved ones had relied on the service in the past. I've spoken to many parents, many families in the community who said without the 24-hour casualty service, they would feel less safe in the knowledge that if in the middle of the night there was an emergency, quick and effective care was just a few minutes away. These parents spoke about Royal Prince Alfred Hospital Emergency Service, where the staff do an amazing job, but we all know the waiting times are 2, 3, often 4 hours, which is clearly not always appropriate. And they saw the elderly family members with chronic conditions who now may have to endure the long and painful delays in RPA's overcrowded waiting rooms. Council conducted a survey in order to get feedback from local residents on this issue, and 88% of respondents said they supported the reintroduction of the service, and in some sections of the electorate, every single person who responded to the survey supported the reintroduction of the service. Half of those surveyed had either used or had a member of their household who used the service in the 3 years prior to its closure, and almost half reported they had an existing condition that may require their visit to a casualty ward. And this is particularly a vital service for the low-income earners, especially in social housing in Balmain and in the Balmain Peninsula, who depend on the casualty ward and have had difficulty travelling to RPA for treatment. Reducing hours at Balmain has forced patients to use the already overstretched facilities at Royal Prince Alfred. Instead of being seen quickly, ill people are often made to wait as RTA tries to cope with the demand from all over Sydney. In my first question as a new MP for Balmain, I asked the Health Minister if the government would restore the 24-hour service. And while the Minister failed to commit to restoring the service, I'm hopeful that we'll be able to work to change the government's mind on this matter. As I've demonstrated, there's evidence of strong support in the community for this, but the data provided by the department, which I'd like to go to, which claims that the numbers are low, undercounts the true use of the service. The data supplied by the department only deals with overnight admissions and does not deal with a large number of patients who are still being treated or have been admitted before the time of 10 p.m. The data we received was only between 10 p.m. and 8 a.m. admissions, not those who are seeking overnight overnight monitoring or came before that period. And anecdotal evidence from doctors who were employed in the service indicated there were regularly several patients that were being attended to, thus significantly increasing the total amount of patients being dealt with by the service. Further, this overnight service, or this 24-hour casualty service, was not promoted at all through the community, and many people did not know that it existed at all. And one of the issues we put to the hospital is that the council and the community would be delighted to promote this, especially because we don't have a 24-hour medical doctor service in close proximity to the peninsula. Now, the other issue that was raised by the department is the lack of staffing, which echoed claims made at the meeting I attended with health officials in 2009, where their proposition was the primary reason for the removal of the 24-hour service was an inability to manage the health services, quite frankly. They couldn't find a doctor. Not a lack or need or insufficient demand, they couldn't find a doctor. Now, if we're in Western New South Wales, I can understand that, but acting Madam Speaker, a doctor in Balmain. I think that it shouldn't be too difficult, and when we challenged this claim, we saw the facts. The claim of challenges in staffing, and I can respond with further data from a doctor who worked in the emergency room in Balmain's 24-hour service before it was closed. And there was a change in the level of qualification required for a doctor to staff that site, and the total amount in cost was about $25,000 difference. And we know from speaking to doctors, and we know from speaking to clinicians in the area, that getting a doctor from RPA or a training doctor with the sufficient qualifications was not a difficult task. The reality was that the level of planning that had been undertaken, which was hopelessly incompetent under the former government, had meant that they did have real challenges. And those challenges were then respectively put onto, well, there's not enough people using it. Oh no, hang on, alternatively, we don't have a doctor. No, I'm sorry, we've got different priorities. Well, the government could not genuinely claim that it couldn't afford to keep the service open for just another $25,000 a year. And I'm happy to make those figures available for members to see about the options and opportunities in terms of the funding model, which Council went through in great detail, which other medical practitioners who are supportive of the service presented to us. So we need to recognise that there were mistakes made by the former government, and those mistakes have had an impact on our local communities. And I call upon the government today to consider reviewing this decision and working with myself and the local community and the council to demonstrate the need and also demonstrate the opportunities to bring back cuts which the former government introduced, something which I know this government is committed to, dealing with the problems from the former government and where health services have been degraded to seek to restore those. Now, at the last election, the people of Balmain clearly expressed their dissatisfaction with the previous government on many of these issues. And the people of Balmain must not be made the victims of the government's failure to properly manage and invest in healthcare. And considering the evidence of strong and widespread community demand for this vital service, along with the clear economic viability, the low costs, the ability to reduce pressure on the emergency wards in RPA, it seems that there is a tremendous opportunity for this government to re-examine this issue and not neglect the people of the Balmain electorate. The issue which is important for us to all take notice of is the impact on RPA, not wanting to put additional pressure onto RPA when a hospital which is already in existence, which the former government committed to maintain in terms of its 24-hour casualty service, that can take pressure off RPA. So the new government, as I mentioned, Madam Acting Speaker, has committed itself to ensure that the people's voices and concerns will be heard. I'm glad that I have the opportunity to express the concerns and voice of the people in the electorate of Balmain, and trust that the government intends to maintain a commitment to investigating the reinstatement of the Balmain Hospital. There is clearly an opportunity for us to make a decision to support what is not only a vital health service for the people of Balmain, but to support one which is economically viable, which provides a great relief to RPA and is also greatly needed. This government, I argue, Madam Acting Speaker, must listen to the concerns of the people of Balmain and the greater population of Sydney, restore the 24-hour casualty service to the great benefit of the health system, the local community, and positive and well-constructed decision-making that governments should be undertaking on these important health matters.
The notice of motion, I call the member for Port Macquarie.